How does dialectical behavior therapy address suicidal thoughts? How does dialectical behavior therapy, often called DBT, specifically help with suicidal thoughts? This therapy is designed to directly target suicidal thoughts and behaviors, rather than just treating underlying issues. DBT recognizes that suicidal behavior often arises from intense emotional pain that feels unbearable. By focusing on these feelings, DBT aims to find practical solutions to address the root causes of suicidal thoughts. One of the key features of DBT is its emphasis on developing core sets of behavioral skills. These skills help individuals manage their emotions, tolerate distress, improve their relationships, and practice mindfulness. For instance, distress tolerance skills are crucial. They teach individuals how to endure painful moments without resorting to self-harm or suicidal actions. Emotion regulation skills are also vital, as they help reduce the intensity and frequency of emotional pain, which can lead to suicidal thinking. Research supports the effectiveness of DBT in reducing suicidal thoughts and behaviors. For example, studies involving adolescents who struggle with self-harm show that those who received DBT reported fewer suicide attempts and less self-harming behavior compared to those who received other types of therapy. The skills learned in DBT not only help with emotional regulation, but also address substance misuse and other behaviors linked to suicide risk. When considering individuals with post-traumatic stress disorder, or PTSD, DBT's approach becomes even more relevant. People with PTSD often experience overwhelming emotional distress and suicidal thoughts. DBT equips them with coping strategies to manage these urges effectively. By teaching practical skills to cope with distress and regulate emotions, DBT helps those with PTSD find healthier ways to deal with trauma-related symptoms. In summary, DBT addresses suicidal thoughts by focusing directly on these issues, teaching skills to manage intense emotions, and improving interpersonal relationships. It provides a structured, evidence-based approach that has shown effectiveness in reducing suicide attempts and self-harm. For those with PTSD, DBT supports the development of coping strategies and safety plans, making it a valuable tool in managing suicidal urges safely. Always remember, if you or someone you know is struggling with suicidal thoughts, seeking help from a healthcare professional is essential.